Good afternoon, everyone. Thank you so much for taking some time to talk a little bit about the data analytics and evaluation services funding opportunity that OCH has out in the world right now. My name is Celeste. If I haven't had a chance to meet you before, it's nice to see some familiar and some new faces here on the screen. So the plan for today is that I will take a few moments to review the funding opportunity, and then really the primary intention behind carving out some time is to give you all the opportunity to ask us any clarifying questions. I think this is where we learn where we weren't as clear as we intended to be, or where we might not have put enough information into the request for proposals. And then early next week, we will post a recording for today's session on the FAQ document that's part of the funding opportunity. And we'll also have answers to any of today's questions listed on the FAQ as well. So to jump right in, this is our funding opportunity webpage. We currently have two funding opportunities available, and the one we're talking about today is data analytics and evaluation. And you can see there are two links here. One is the overview and instructions, and the other is the link to our frequently asked questions. So the overview and instructions document is a PDF that hopefully everyone was able to access. Grounding in the purpose of this is OCH seeks to contract with one or more entities to provide data analytics and evaluation services for our organization. The applicants can choose to apply for one or more of the projects that best align with their skills, strengths, and capacity. And we'll run through the projects as part of this document. For those who aren't aware, Olympic Community of Health is a nonprofit that serves the 3-county region of Clallam, Jefferson, and Kitsap counties in Washington state. And we also partner with 7 sovereign tribal nations. Our overarching goal is to improve individual and population health and advance equity by addressing the determinants of health. And then it's also relevant for me to share a little bit about Olympic Connect, as one of the bigger projects in this funding opportunity is all about Olympic Connect. So Olympic Connect is a new service of OCH that is expected to launch in early 2025. Olympic Connect is a community care hub, or a community-centered entity that supports a network of partners who provide services and resources to address social needs. And we've got a little bit more information about Olympic Connect here, and we don't have a website built yet for Olympic Connect, but we do have a blog post where you can learn a little bit more, and there's a quick video that gives a little bit more of an introduction to Olympic Connect as well. So for the desired services for this funding opportunity, just setting this stage, that OCH is involved with a variety of projects that are aimed at achieving our broad goal. Some of those projects our staff team leads directly. We are a collaborator on others, and we also provide a lot of funding to health-serving partners in our region. And data analytics and evaluation are a cornerstone in our organization. They help provide our board of directors with some guidance on how to prioritize the work of the organization. And of course, data drives our planning and supports our team and partners in determining how we invest our dollars and prioritize actions. So we have a few projects that are outlined in this funding opportunity. As I shared a moment ago, applicants can choose to submit a proposal for one or more of those projects. So you don't have to submit for all of them. You can kind of see what aligns best with your skills and strengths and submit a proposal that way. So in this next section of the document, we have a brief description of each of those projects, and I'll walk through that now. So the first project is to provide data analytics and evaluation support for Olympic Connect, which is that community care hub that I mentioned. And this is an annual scope of work, so will be an annual contract through at least 2028. And we are allocating up to $100,000 per year. So we are looking for specifically for data analytics and evaluation support of Olympic Community of Health's Community Care Hub, and also want to acknowledge that the other 8 ACHs are also developing community care hubs, and we have an aligned some work to align the work of the 9 hubs, and that starts with a single statewide measurement set that we can share with a contractor once we get under contract. So the key questions for hub evaluation include: how does Olympic Connect identify and engage individuals and groups that could benefit from services? How do we build and support a diverse network of partners and providers? And how does Olympic Connect support the community-based workforce? What impact does Olympic Connect have on client health and well-being? And then we will likely add additional questions once our partners get to a decision point around adding some measures that are important to our 3-county region. This next section outlines some of the available data that we have. So like I mentioned, we have a statewide measurement set that includes measures from a results-based accountability framework, including how much did we do, how well did we do it, and is anyone or any system better off? And our regional partners will be adding some local measures, and we have some of our funders are also asking us to measure some specific pieces based on their interests. So most of the data for Olympic Connect will be available via shared cloud-based regional community information exchange technology, which will track client engagement, referrals, progress in the hub. And then we will also be collecting other data through long-term health outcomes, some different survey instruments that partners and our community-based workforce will be participating in, and some other sources. And so we will be also asking the contractor for this project to help us create some of those tools, some of the tailoring some of the reports through the technology and components like that. So some of the key deliverables for this project is to determine a system for creating dashboard reports and routine reporting to our staff team, our board, our contracted partners, our funders, the broad partner network, and other stakeholders as appropriate. The contractor will support the OCH staff in the development, analytics, and reports, and work closely with the other 8 community care hubs to support ongoing transparency and alignment across the state. The dashboards are expected to be in clear, plain language, easy to understand visuals, especially for those more of a lay audience, for people who don't have a lot of data knowledge. And 2 of the significant deliverables here is a mid-project report in about the middle of 2026 and a project end report in 2028 or 2029. The next project is to support our staff in our online connecting to data tool. This is also an annual project with an up to amount of $35,000 per year. So back in 2023, we launched a pretty simple connecting to data tool in response to requests from our partners who are wanting to have really accessible, clear, easy to understand regional health transformation data. And the intention was that we got that updated annually. We have not updated it since we launched it, however. It was developed as a result of a collaborative process in 2022 to identify regional actions and measures for the projects and focus areas identified in OCH's current strategic plan. The original vision for this tool was to support partners in accessing local data. So when they're writing grant applications or creating presentation slide decks or things like that. And then also for the OCH staff to foster engagement at our learnings, convenings, and other ways that we engage partners. So there are various data sources identified in the current tool, and then we can provide access to data sources as needed, and then all sources are cited within that tool if you want to learn more about the data sources. So what we're looking for here is a contractor to provide annual updates and to create and implement a larger vision for a robust data engagement tool to be used by our partners. The next project is to align and coordinate various community health needs assessments for our region. This is a project that will be every other year, so 2025 and 2027, with an annual up to amount of $40,000. So the overview here is that many of the partnering organizations and tribes in our region are required or choose to conduct some sort of a version of a community health needs assessment so that they can identify and what the needs are so they can prioritize work. So what we are looking for here is a contract to create and implement a process for bringing those individual needs assessments together into one Olympic region assessment. So we're not asking you to conduct a needs assessment, but to roll all of the individual assessments up into a single report or maybe a website or other tool, so that partners can have access to what's happening across the region, and so that OCH can provide that information to our funders. So looking for a rolled up summary of partner-led assessments, and we will use this tool to create cohesion and alignment across the region. The contractor for this project can coordinate with OCH communications staff to create a robust engagement and outreach strategy to spread the word. And then the last project out of this funding opportunity is a one-time project for 2025, and that is to support evaluation of the various mobile integrated health programs in the Olympic region. So in 2023, our staff created a report that summarizes the various mobile integrated health programs in the region. And at that time, not all of the programs were fully up and running, and they didn't have enough quantitative data back in 2023 to support an evaluation. And so since that time, most of the programs now have been up and running for a while. They have been collecting data, and they're now very interested in learning how their programs are having impact in our communities. So the intended audience for this evaluation are the organizations who are leading and implementing the programs, various elected officials at the local, state, and federal level who set policies and funding opportunities for these kinds of programs, and other statewide networks and associations, and of course the OCH partner network. So the mobile integrated health programs in the different communities in the region have individual quantitative and qualitative data. And I will say that their methodology does vary a lot by program. So what we're looking for here is a contractor to connect with these different programs to identify successes, challenges, and opportunities for sustainability. So because each program does hold and collect their own data, I think one big step of this project is to figure out a way how to compare those different data sources and data collection strategies in a cohesive way for this evaluation, and then also provide some feedback to those program partners so that they can be a little bit more efficient and effective in their data collection strategies moving forward. And for this project, we did want to note that some of those individual programs may also ask this contractor to have a separate contract for any individual needs or technical assistance or support that they might have. So eligibility for this funding opportunity is pretty broad. It's organizations, tribes, governmental entities, both within our region and outside of the region. You just have to be in good financial standing and be an established legal entity. And our staff, once we get under contract, will provide regular communication and engagement, access to available data, access to the partner network as it's needed, historical context and background, and then access to any relevant statewide organizations, contractors, or other consultants. The funding model for this is, as was delineated up above under each project, there's an up to amount per project. And applicants are required to submit a detailed budget for the project, and we're asking for those to happen in Excel. The timeline for this funding opportunity, we are here at the optional information session. We have an FAQ document that's available up until the November 4th proposal deadline. Proposals are to be submitted to our email address. We will review and score in the middle of November, and then we will notify applicants of their status on the 18th of November, and those who will be invited to move forward will be invited to a Zoom interview with our staff, which will happen towards the end of November through the first part of December. And then we'll make decisions on December 10th and start contracting shortly after that. And it's our hope that contracts will start in January. The initial contract will be for 12 months for the year of 2025, with contract extensions through at least 2028 based on our contractor performance, the needs of OCH, our funding, and our capacity. And then a reminder that both of the projects are on a little bit of a different time frame. We've also outlined our overview scoring and evaluation criteria. We are asking that proposals be submitted as a single PDF attachment. And we've provided the scoring information below. If you have like supplemental information, that's totally fine. Just please include it in the same single PDF attachment. Our staff will conduct a technical review of proposals to ensure that all of the information is included, and we will respond to let people know that their application was received or if we need additional information. So the elements for the scoring criteria are listed here. So we have applicant qualifications, content and subject matter expertise, the approach and plan for moving the work forward, collaboration, equity and innovation, and the budget. So there are 60 total points available for this funding opportunity. And then you can see for each of the projects, we will review for the element, for these different elements that are outlined in the bullets here. And then, as I mentioned, some of the proposals will be invited to a second phase of this process, which will be a 60-minute virtual interview with OCH staff. And this is an opportunity for both parties to ask clarifying questions and to ascertain the potential for a long-term partnership. So the interview is not scored, but it will support OCH in making final decisions. OCH staff have final decision-making authority based on the written proposals, the budget, the virtual interview, and then we will also, take that big picture view to ensure that everything aligns with our organizational and regional needs to support our mission and goal. As for technical assistance along the way, we of course have the session today. We have the online FAQ document that we'll be updating regularly, and you are welcome to email us at och@olympic.ch.org, and we will respond as quickly as possible. And then finally, we've outlined some contract requirements, just so things are clear up front. I think most of these are pretty standard. And then submitting your proposal is pretty easy. It's a single PDF attachment for the written proposal, a Microsoft Excel document for the budget, and you can determine your own format for that. And the deadline is 5 p.m. on Monday, November 4th. And then the window for the Zoom interviews is November 25th through December 9th, and we will send scheduling information for those by November 18th. And then final decisions and notifications for that will happen on December 10th. So I have probably rambled on quite enough, so I will pause here and open it up for your questions. And curiosities about this.
Thanks for the presentation, really helpful. Wondering for that first body of work with both analytics and evaluation, are you all open to splitting up that work at all? Like having a group do the analytics, but not necessarily the evaluation, or are you really hoping to keep those two packaged together?
And Sarah, just to be clear, you're asking specifically about the Olympic Connect component?
Yeah. Mm-hmm.
Yeah, it's my preference that we have a single contract for that, and we're open if there needs to be subcontracts, you know, with other groups, but I'd like to keep that body of work under a single contract.
Okay, perfect. Thank you so much.
But subcontracting is totally fine.
Perfect. Thanks.
Thanks for having us. The second project, the one about online collecting, connecting to data tool. I was just curious if you are tied to the existing technical solution, like the website you have set up with, you know, clickable images to look at those graphics, or you might be interested in exploring other ways to kind of communicate that data. I don't know if you could really get into that detail, so I was just curious.
Yeah, totally.
The existing format.
Totally, Phil. Thanks for asking about that, and thanks for being here. Yeah, I think what I say here that kind of starts to get at that is creating and implementing a larger vision.
Okay.
Yeah, it was something that we were trying to be responsive to partners that, you know, they were struggling in like where to find different health transformation data, and so we kind of quickly put something on the website, but yeah, totally open to other formats as long as they're really accessible to partners. We didn't want to put anything behind any sort of a password wall or things that are just kind of cloud-based, simple to access. But yes, totally open to different formats.
Got it. Thank you.
Yeah.
Hi, I have a question about the first project, the Olympic Connect.
Yeah.
Can you describe more about the infrastructure where you'd be building dashboards and connecting to data?
A little bit. I'm sadly not the expert on the technology system that we're using, but the technology that we're using for the client management system and for referrals and the resource directory and all of that, it's under a platform that was created by Ready Computing. And so it's the name of the tool is called Connect to Coordinator, which is a software system that falls under the Ready Computing platform that was homegrown by actually a sister accountable community of health, the one in King County called Healthier Here. So we are sort of piggybacking onto the system that they've invested a lot of time and dollars into creating. And my understanding is that that we have created a workflow within that. And there's a lot of intake processes for when we're working with new clients and providers. And then there's some tools on the back end where we can download different reports and analytics based on like, you know, how many referrals did we get, and how many clients have met their goals, how many clients have had a social needs screening, how many clients are actively engaged in working with a resource or service provider to get a social need met. So it's pretty robust, and my understanding, it's just a matter of kind of telling the tool how you want the reports to look like, and then you can pull them. But I don't think it's difficult.
And so would you be looking to build dashboards within this tool or just using the reports that are generated from it?
Probably some combination of that I think we would be able to pull reports from the tool and then create dashboards from there. Yeah.
Okay.
Sorry, I didn't realize that your question was that simple.
That's all right. I'm trying to figure it out as we're talking, but thank you very much.
Yeah.
Hi, Celeste. I have a question about the third opportunity, the Regional Community Health Needs Assessment. Do you know about how many partners or partner-led assessments would be included in that process?
Yeah, hey Allison, thanks for joining. Nice to see your name.
Yeah.
I don't know. And we'd also want to make this probably, fairly reasonable. Like my assumption is that our federally qualified health centers have to do those, our 3 public health departments. I think our hospital partners typically are required to organize some sort of a community needs assessment. And then I know there's a few like community-based organizations that do something similar. So if I had to guess, I'd probably say 12 or 15. And I think part of the process would be for us to identify like, which ones would we use for a regional roll up? Because I do think there's probably some, it probably starts to get repetitive with some.
Okay. Got it. Thank you.
That's a good clarifying question though. Thank you.
And I have one more question on this project. So I just a little bit more clarity, if you could, around the deliverable. So like a report versus a website could be, 2 very different things. So maybe just some clarity around what you were hoping for with that.
Yeah, we don't have a solid vision for that, Allison, which is why we left it fairly open-ended here. So I think that's something that OCH and the contractor for this project could discuss together. I don't know if it's like, we want it to be, I think it's more about it being very easy for partners to use, yeah, so I think like even like a slide deck or it's more about it being accessible, transparent, kind of easy to find and flow.
Got it. Thank you.
Yeah. Well, I'm happy to stay on the line as you have other questions. So just to close it out, the applications for this are due the first part of November, and we'll be looking to make decisions in that second week of December. So look forward to seeing your proposals, answering any questions along the line. Again, I can go ahead and we can stop here unless there's other questions coming to mind. And I'm also happy to stay on for a few moments if you wanted to ask your question offline.
I have a quick question that came to mind. Do you guys have any preferred dashboarding or visualization tools that you use?
No, we're pretty open.
Cool. Thank you.
Yeah. All right, well, I'm going to go ahead and stop the recording. Really appreciate everybody's time. Hopefully these projects align with the work that you're doing and they spark some interest, and look forward to the opportunity to partner with you all. Take care.